Hey YouTube, no checking for the light today. I'm going to keep this yellow murky background with the strange effects of the lighting in this room and just go at it because what I've got to say is kind of important to me. Um, I know I don't have a lot of subscribers, but that's not too much to worry about at this point in time, but I understand that you wouldn't subscribe to me, you weren't important. You wouldn't have subscribed to me if you didn't think I was important or interesting or what have you. Um, the holidays are coming, and all my Christmas shopping is done. My grandson is taken care of, and will be well loved throughout those holidays. But I've been becoming quite concerned lately about my own personal health. Um, it's not an easy subject to talk about, but it has caused me to miss a significant amount of time from work. It has caused dissension between coworkers and my employers and a lot of other people. But more important, it's caused concern with myself. The medical conditions that I have include severe arthritis in my right knee, which is the exacerbation of an injury that I sustained a number of years ago. And I was told at the time that it was, by the time I reached this age of 50s, it was going to be rough. I've had a number of injections and whatnot, and the orthopedist says that what I need is a total knee replacement. But because of other medical conditions that I have, I'm not a very good candidate for that. And one of those other medical conditions that I have, severe lung disease, asthma in particular. I have a history of heart problems. I've already had a triple bypass and a stent, numerous of cardiac caths, and in addition to that, I have a blood clotting disorder, which would be like the reverse of, you know what hemophilia is. Those people don't make blood clots. I'm due, and I make too many, and I've had a number of blood clots in my leg, the right leg, the one that's got the arthritis, and several that have gone to my lungs. Of late, my breathing has become quite labored on almost any type of activity. And I was trying to pass it off as a change in the weather, because the weather here in Michigan has been absurd, really screwy, going from cold to mild to balmy to wet and rainy, and it just hasn't been good for those like us who have lung diseases to contend with. And that's what I was putting it off to. Then I read that a fellow former church member from a church that I belonged to for the past 9 years before I moved to the city I'm in now, who had had a bypass surgery about the same time I had my original, round up in the hospital this week after a cardiac cath revealed that his was no longer effective. His bypass was no longer effective. They were clogged to the 95 percentile level. And I'm thinking that that is what's becoming me now, and I'm very, very frightened. Work is stressful, which I don't need, and I've got time to take, but my decision is, should I go and have the cardiologist do a cath, which I'm sure is going to wind up disclosing that I have severe cardiac problems again, or do what work wants me to do and go and have my knee replaced. That means they can put me outside and do some other stuff, but it's all really a major hassle and a bunch of bullshit. Right now I'm looking at going to the doctor and having a cardiac cath, knowing that I'm probably going to have the heart disease diagnosed severe once again and need a bypass, which is going to put me out for 3 to 5 months. And I'll have enough time, but I don't know if coming after that point in time, if I'll get a full return to work, with my lung condition still being the way it is, my arthritis still being the way it is, at which point I think I'm going to just seek a disability and leave that place of employment. And that's one of the reasons why I'm broadcasting here, because at this point in time, I don't know of anyone who knows at work that knows my handle who could leak this to human resources and disclose my intent. So that being said, if those of you who would pray for me so I can help make the decisions to when to go in and without disrupting the family's holiday, and that whatever progress that I make will be well, and the decisions that I make or need to make after I return from surgery will be best for this entire family. I think my next video will probably explain to you just exactly what type of a family I'm living with and our dynamics that we have here, so you can understand why this is such a very precarious situation. So for now, I'm not healthy, and I haven't been healthy for a very, very long time, and things are going to come to a head very, very quickly. Take care. Got any comments? Put them down there, and I'll talk to you in a while, or the next time I decide to put a video up, which could be soon. Bye now.